Welcome to our introductory course on healthcare reform, navigating the changing benefits environment. In today's presentation, we'll talk about some of the key changes being brought by the healthcare reform law and what this means for you as an AFLAC agent. The healthcare reform legislation is reshaping how employers offer and administer benefits for their employees. The continuing rise in healthcare costs and the shift to consumer-driven healthcare will increase the need for employers and employees to better understand the healthcare landscape, their options, and potential solutions. This provides an attractive opportunity for AFLAC agents to help employers and employees get educated and adapt to these changes. In addition, as more people have access to the health system, we'll have a wider audience with whom to discuss how voluntary insurance may supplement existing benefits to add even greater coverage and financial security. The goal is to enhance our position as benefits advisors, who will help the consumer deal with these changes over the next few years. Ultimately, this will allow us to have more conversations about AFLAC, the products we offer, and how they help people. In order to fulfill this important responsibility, there are key things you need to understand about healthcare reform. We know that the complexity of the regulatory changes and the political noise can make this topic feel a bit overwhelming. This is why the AFLAC Sales Academy has designed a curriculum that simplifies the content and will help you become more knowledgeable. This is the introductory course. It will equip you with the minimum information necessary to address questions and concerns you may get about HCR. Later, we'll talk about other Sales Academy resources that can help you learn more. Let's get started. The Patient Protection and Affordable Care Act, or PPACA, is a federal statute that was signed into law by President Obama in 2010. This act and the Healthcare and Education Reconciliation Act of 2010 make up what is popularly referred to as healthcare reform. According to the government, more than half of the U.S. population, or approximately 160 million people, get health insurance directly through their employers. Tens of millions more consumers either buy their own private insurance or are covered by government programs, such as Medicaid and Medicare, while approximately 50 million people have no insurance. Healthcare reform has widespread implications for all these people, both the insured and uninsured. Several key mandates have already gone into effect since the law passed in 2010. Here's a rundown of those provisions, as well as some new mandates rolling out over the next few years. Employees will receive several benefits mandated by health reform that have already gone into effect. Among the main provisions, employer-provided coverage must cover dependent children to age 26 unless the dependent has access to employer-provided coverage. Health plans must cover certain preventative services, such as mammograms and colonoscopies, without charging a deductible, copay, or coinsurance. And insurers cannot impose a maximum lifetime dollar limit on a customer's medical care. It's very important to note that employers who offer insurance will now be even more focused on controlling their healthcare costs. This means employees will likely see further increases in premiums and deductibles. As we'll discuss in a few minutes, this has important implications for AFLAC. Also, starting in 2013, the healthcare law will limit employee contributions to flexible spending accounts to a maximum of $2,500 a year. About 15 million U.S. consumers buy health insurance directly from private insurers or work for businesses that do so. Under healthcare reform, insurers must also allow policyholders to add adult dependents up to age 26 to their plan. Beginning in 2014, insurers cannot drop an individual if they become sick, and they cannot refuse coverage for a pre-existing condition. Insurers also cannot set annual or lifetime limits on the amount of care. Come 2014, if you don't have health coverage, you'll have to pay a penalty. Another big change is the introduction of health insurance exchanges. The law mandates that states set up health insurance exchanges by 2014. These will be marketplaces where consumers who don't have access to affordable employer-provided coverage can purchase health insurance. Some individuals may qualify for premium and cost-sharing subsidies. The amount subsidized will be determined by an individual's income level, age, type of coverage, and market demographics. It's important to note that there will be different implications of the new laws based on employer size. By 2014, companies with 50 or more full-time employees must start providing health insurance or face penalties. For companies with fewer than 50 employees, there is no penalty for not offering insurance. So these employers may be able to save money by dropping coverage and letting their employees purchase it through the exchange, even if they compensate employees by giving them higher salaries or offering them other benefits. These are just some of the highlights of the new law. To gain more in-depth knowledge, please check out our detailed Healthcare Reform e-learning course. The primary focus of healthcare reform is to ensure that Americans of all ages and incomes are protected by creditable, comprehensive major medical health insurance. Because supplemental insurance is not major medical insurance, the law has limited direct effect on these voluntary insurance products. Although healthcare reform does not directly apply to voluntary insurance, several related trends may increase the demand for supplemental products. Whether they are insured through employer or exchange plans, employees will continue to grapple with rising out-of-pocket healthcare costs, which will increase demand for supplemental insurance to help with expenses associated with a serious accident or illness that major medical insurance was never intended to cover. In the past, many have relied on flexible spending accounts to fill this gap. However, as we talked about briefly, new FSA limitations and caps will likely create more out-of-pocket expenditures that are not eligible for reimbursement, further creating demand for supplemental products. With the establishment of minimum standards, major medical coverage will likely become more homogeneous than it is today. This will make an employer's supplemental insurance offerings a greater differentiator than ever before in the talent marketplace. So in a nutshell, because cash is always welcome in the event of sickness or injury, the added protection voluntary insurance offers will continue to be in strong demand. In fact, we've seen this outcome in Japan, a country that has had a national healthcare system for many years. Our policies are highly regarded by the citizens of Japan, where Aflac is actually the #1 insurance company for individual policies. The goal of the Aflac Sales Academy is to equip you with the knowledge and skills you need to succeed. One important element of the Academy's mission is to serve as the platform to educate the field force on healthcare reform. Our healthcare reform topic website will serve as a one-stop shop for healthcare reform. Here you'll find up-to-date learning resources and other tools to help you with your employer and employee conversations. These will include a healthcare reform channel, which will provide regular updates on legislative changes, job aids and tip sheets, which will be used as reinforcement, and tools which will allow you to share experiences and learning with your colleagues in the field force. Some of you may be interested in becoming certified advisors as part of your career development. We'll outline training available through the American College that will offer certification for healthcare reform and becoming a certified employee benefits consultant. This will provide deeper industry learning and greater credibility with your clients. While healthcare reform brings about many changes, it also offers unique opportunities. To enhance our position as benefits advisors and best help employers and employees, we need to become more specialized in healthcare reform. Hope you're excited about this opportunity. Stay tuned for continued updates.